this morning's Health Watch, treating your summer skin damage. If you haven't been applying that sunscreen as you should have, board-certified dermatologist Dr. Jeanine Downie is here with some aftercare products and treatments that may help. Of course, though, we don't want to forego the sunscreen. Very important, doctor.
Exactly.
But there, even sometimes with sunscreen, if you don't have enough on, you can get some damage from the sun. What are the most prominent, most problematic types of sun damage?
Well, okay, so first you see freckling. You can see broken blood vessels, texture changes, tone changes, fine lines, wrinkles, and you can see precancerous and cancerous lesions, Erica. And the bottom line is that there's 3.5 million Americans will be diagnosed with skin cancer this year in the United States alone. So it's 1 in 5 Americans that'll be diagnosed with skin cancer over their lifetime. So this is a real problem. It applies to everyone.
And we need to take stock of this and be sure we're doing the right thing. So Heather has graciously agreed to be our volunteer, and you actually took a look at some of the sun damage that she has that we may not be able to see. Talk us through what we're looking at here.
Okay, so Heather is 34 years old. She grew up in New Jersey, multiple sunburns, many of them blistering, had a great time in the sun when she was a bit younger. Blue eyes and fair. So this is her pre-picture right here. And any freckling at all means sun damage. Women can look at the underside of their breast for what their skin's really supposed to look like. Men can look at their tushes to see what their skin's really supposed to look like. But any freckling at all means sun damage. And this is the Vizia, which is sold worldwide, which is fabulous, which shows you your level of sun damage. And then this is the picture with the UV. And what it does is it actually shows the deeper amount of cellular damage that you see there.
So all of those spots are that deep cellular damage.
Exactly. And you can even see it coalescing on her lips right here, that line right here. We need to put sunblock on her lips too.
So when you look at all these, you have some products that can help people deal with the sun damage they have. The first one being an uneven skin tone. And you brought some over-the-counter and some prescription options for us. So first talk us through the over-the-counter.
Okay, so the bottom line is that Kiehl's has a new product line here that helps in terms of evening out your skin tone. The Clinique Even Better Skin Tone Corrector works very well, and so does the Vivite Vibrance. And they all have different ingredients in there, but the bottom line is that they help to disperse the pigment and even out your skin tone.
So that'll even it out, and that's the over-the-counter. And there is also a prescription option that you can talk to your dermatologist about.
Exactly. So Triluma is something that I personally use that I think you just said.
My dermatologist just recommended to me for some of my dark spots.
Right, exactly. So that is something that's wonderful for dark spots, and that's a prescription.
Does it essentially just bleach your skin?
It actually is a 4% hydroquinone is the active ingredient. It's a triple combination product, and so it helps with, you know, just like maybe a dark spot after a pimple. It helps with overall melasma. It helps with a bunch of things. Like I said, I'm a user. And then this is the TNS Essential Serum. This builds collagen and it evens out your skin tone. This is a cosmeceutical. And the Retin-A also builds collagen and evens out your skin tone as well. So this is a prescription, this is a prescription, and this you can get from your doc's office.
So we've dealt with uneven skin tone, fine lines, which we know you get a lot of lines from sun damage. There are actually some over-the-counter products that you say do work well on fine lines and wrinkles.
Right, exactly. So there's a Garnier product here, there's a Rock product here, there's the Olay Regenerist, which won all kinds of awards, which has matrixyl in it, which is a peptide that helps to build collagen and even out your skin tone. And this Skin Medica product, the Tri-Retinol Complex ES, just came out like literally within the past week or two, and it actually has a retinol in it that's equivalent to prescription retinoids in terms of building collagen.
So that'll really do a good job. Or you can go for an in-office treatment, and those are things like injectables that'll sort of fill up that space and tighten you up a little bit.
Exactly. So I am Botox. You see when I frown right here. And that's something that I swear by. So I do feel that, you know, for your movement lines on your face, that you want to slow down your aging. You don't want to look like your cousin or your mom or whoever it is that has those lines on the face. That Botox works great. Perlane and Juvederm are both products that are hyaluronic acids that actually plump up and fill. So you use them in your cheeks. As you
get older and your cheeks start to hollow out, you can add a little more.
We lose 1 teaspoon of collagen from our face every year from the time we're 30. This is frightening. And so it kicks in when we're around 45.
just when you need it. There are also, we talked about, of course, the unseen damage, which we saw a little bit of with Heather. Is any of that reversible?
Right, okay, it is reversible, some of it. And so what I recommend here is the Rivale Skin Intense Recovery, which is a coffee berry-based product that's kind of an organoceutical, and the Provage MD. Yeah, it's like very interesting. The sub-ripe coffee berry. Basically, it was in Mexico and Costa Rica. The coffee berry pickers, their hands look very youthful and their faces were weathered, and that's how they figured out this product to begin with. And then the Provage MD is edibonone, and so it's a relative of coenzyme Q10, and both of them help to correct your sun damage from the past. And they're powerful antioxidants, and they protect against future sun damage.
And of course, also important that always wear your skincare. Now you say at least 30 SPF. Great to have you with us, Doctor.
Every single day, sunblock.
Thanks for being in with us.